bit about how to publish in the Obstetrician and Gynecologist Journal. As many of you know, this is the training and CPD official journal for Royal College of Obstetrician and Gynecologists in the UK. The actual impact factor is 1.4. It is not on PubMed because it is not a journal that caters to original research. It's a journal that commissions articles, and as such, the acceptance rate is actually quite high, 84%. At the moment, it's subscription only, i.e. not open access, and by default at the moment, it's paperless, although you can request for small payment a hard copy of the journal. But I'm sure you all know what the journal cover looks like. At the moment, I am the Deputy Editor-in-Chief, and Dr. Joe Morrison is the Editor-in-Chief, but I will take over from Joe in June 2026 as Editor-in-Chief. There's a whole variety of UK-based and international editorial board members, although I noticed that there's no one from Pakistan at the moment, and I certainly encourage you all to apply at the next round. I will talk a little bit about the role and function of the journal, its characteristics, and later on how to submit and the actual review processes we use. As mentioned earlier, TOG is a CPD and training journal, and these are the categories of articles that we provide. As you can see, we do not publish case reports or original research. TOG welcomes reviews on relevant clinical topics such as management of non-diabetic large for gestational age babies, or, for example, recent advances in non-surgical management of endometriosis. You can also submit a commentary on a relevant recent topic or an educational article, or tips and techniques on procedures relevant to trainees. For example, we recently published something on which compression suture trainees should use in atonic postpartum hemorrhage. This slide shows the circulation of the journal. There are over 4,400 institutions worldwide which actually accesses this journal. The majority in Europe and the rest of the world, and about 268 institutions in the UK accessing it as well. This slide demonstrates the top 10 countries that actually use or download TOG articles. Obviously, the largest proportion really is in the UK, and then the rest of the world, also United States and Asia. And you can see Pakistan there actually, around, what is it, 4%. It shows the most downloaded and read article from TOG through the years. These are the top 10 articles. Number 1 really is Non-Immune Hydrop Fetalis, a practical guide to obstetricians. And this has had over 15,000 downloads. Next really is the Diagnosis and Management of Tubal Ovarian Abscess with over 14,000 downloads, and so forth. This slide shows the most cited TOG papers by other authors in 2023-2024. So you can see papers by Justin Konje, by Kate Navaratnam. For example, there's a nice one, Quantification of Blood Loss in Obstetric Hemorrhage, by Bid Kumar and myself. I've got 2 papers there. The actual rejection rate of submitted articles is actually extremely low, and the acceptance rate is 84%. And this is because you actually have to submit a proposal to us. The editorial board will then consider it and then go and commission your article if we think it is relevant. Once it's commissioned, you have approximately 12 weeks to actually submit, but you can ask for a deferment if you're not able to do it in the time frame. Provided the article is of good quality, there's no reason for it to be rejected. We only reject articles if the quality is poor, if there's no engagement from the senior author, and if there is no improvement despite several revisions. Now, United Kingdom, as you can see from the graph on the right, is the country that does most submissions, and we will really look forward to proposals and eventual submissions from Pakistan. So what do you do if you want to publish your paper in TOG? The first thing you do really is to download a speculative submission form or speculative proposal form from the website. It's a Word document. It looks a little bit like this, and you have to put down the title, who your co-authors are. Fill that in. Here is another example. So here we wanted to write a commentary on enhanced recovery and what we can learn from elite sportsmen. Okay, so the title is along the lines of transforming enhanced recovery, what we can learn from Team GB Olympic cycling successes. Okay, how it affects and how we can improve same-day discharge hysterectomy rates. So you list the co-authors down, and obviously the co-authors have to be relevant. So for example, here we've got a combination of anesthetist, consultant obstetrician gynecologist, and then we've got an Olympic silver medalist, okay, in rowing, and then we've got 2 registrars. Next, you have to put in a summary of your proposal, roughly in 200 to 250 words, why you want to do this. Explain what is the intention of the paper, what's the content, what are learning objectives, and what the readers can hope to benefit out of it. So that submission basically will be received by Beth Webster, the managing director of TOG, and she will then put it through to the editorial board of the journal, and the editorial board will then assess to see its suitability. So essentially, if everybody thinks it's a good paper, it's a good submission, we will then commission it. So we will then write to you to say that's a good proposal. We would like to commission you. Normally, we give you around 12 weeks from the day we commission you to final submission. The average decision time for us to make a decision is roughly 71 days. Okay, so this is the end product of that particular TOG speculative proposal. The title has changed a little bit as recommended by the editorial board. So now it reads Enhanced Recovery Revisited, How Day Case Hysterectomies Can Learn from Team GB Elite Athletes. Okay, and we wrote basically about how Olympic and elite athletes use the concept of marginal gains, where we call it the 1% improvement theory. So if you're fitter by 1%, if your nutrition is better by 1%, if your suit is more aerodynamic by 1%, if your mental rest is better by 1%, overall you will actually, the cumulative effect really is that you win. And that's what happens to day case hysterectomies. So essentially, if you educate the patients beforehand, make sure that you optimize preoperative condition. Intraoperatively, make sure you do minimally invasive surgery, if possible, just vaginal surgery. And then postoperatively, no catheters, no PACs. Encourage mobilization, and then don't actually keep them overnight. Okay, good analgesia, etc. And then they actually, most of them will. Here is an example of a tips and techniques article. So tips and techniques basically refer to a section where you submit a proposal on a particular procedure. So in this case, it was Manchester repair that we put a proposal for. Obviously, you need to have a look in the archives to make sure that the same procedure hasn't been written up previously in TOG. So in this case, it hasn't. And we put in a proposal about Manchester repair, how to do it, the benefits, the complications, etc. It was commissioned, and it took probably about 12 to 14 weeks for us to actually prepare it, and the end product looks a bit like this. Okay, and quite often it's very useful for tips and techniques to actually include with the submission video footage of the the actual procedure. It makes it much more interesting and engaging. Imagine that you've submitted the speculative proposal, the editorial board like it, and they've commissioned your article. So what happens then? So after 12 weeks, you basically put in the entire article, and it goes through a rigorous review process. So as you know, the editorial board consists of many members, and they have all different subspecialties. So for example, there's reproductive medicine, urogyne, oncology, could be generalist, fetal medicine, maternal medicine, etc. So depending on your article, it'll get allocated to different associate editors. So for example, the article on tips and techniques on Manchester repair probably got allocated to one of the associate editors who specializes in urogynecology. They will then look for 2 reviewers. So the associate editors do not review them. They will then find 2 reviewers who will review the article. And once that's reviewed, the 2 reviewers will feed back to the associate editor, and then the associate editor will then make a decision, and you will get a communication from the editor-in-chief. Usually, most submissions will need 1 or 2 revisions. It's quite rare that you submit and it is accepted unchanged. So time taken for us to decide the speculative proposal is usually around 71 days. And then it's a further 12 weeks to for you to actually submit the article. And then the review process by the 2 reviewers probably takes, I don't know, between 2 and 4 weeks. So overall, the time you commission to the time it comes out in publication could be anything between sort of 6 to 12 months. So you have to be patient with that. Here is an example of an article that we published in TOG a few years back. What happened really was that my colleague Wasim Lodi was in an aeroplane in a flight to Pakistan, I think, and he was asked to come and help with a patient on as a flight emergency, and in a way he didn't know what to do. So we actually discussed this. It's quite interesting because basically it can be an issue with obstetrician and gynecologists being asked to come and assist. So what do you expect when you're called into action? So that was a commentary basically that you don't need to panic. So essentially there's a list of available instruments and drugs on the plane. If you are called, it's very rare that you actually require skills of an obstetrician and gynecologist, but they will expect that you'll be able to manage as a general doctor at FY1 or FY2 or registrar level. The commonest indication of being called really is syncopal attack, okay? And really, all you need to do really is stabilize the patient, and then you basically link up with the medical team on the ground, and they will talk you through what to do. So in a way, you don't need to panic. So that's quite an interesting commentary that was commissioned a few years back. 2 articles that I myself was involved in submitting in the beginning and then writing in the end. So one was on V-Notes. There was a commentary a few years ago where we were starting to do V-Notes, and I thought it'd be interesting for us to raise awareness of vaginal natural orifice transluminal endoscopic surgery. And then the article on the right basically is an educational one on one aspect of human factors we call the helicopter view. So I hope that the talk has helped. Please, actually, we are looking for a lot of submissions from Pakistan. Do download the speculative proposal form, put in a proposal, do a literature review of the archives to make sure that your proposal is original and hasn't been done recently. Put it in, and then we will guide you through it. All the best, and thank you.